Welcome to episode 9 of Beyond Zero's podcast. Coming up,
human rights can be translated or transmuted from human rights to legal rights, and I help people to get justice.
But
it's about the bed gymnastics. How did it say? Udlala betting.
The boy didn't matter how I feel, and then he just took my rights for granted. Yeah, and then he told himself, oh, I'm doing this because I want to. So at the same time, I felt so pity for him.
there are different concerns. So how would I know, I'm a 12-year-old or I'm an 11-year-old and I want to go to the clinic and access a certain service? How will I know that I'm being denied? And I'm a 16-year-old, I wanted to access service. I want to use these two scenarios. 11-year-old wants to go to the clinic and access maybe depot or condoms or maybe just information about health.
I had come here to save space so that I can know my HIV status. And I could say it went effortlessly smooth.
today we will be unpacking human rights with Lerato Morulane.
Dumelang sanbonani absheni khotso. My name is Lerato Morulane. Setlogolo sa barolong khadi e setlhana gare ga masogana. Welcome to today's podcast whereby we will be unpacking human rights. Now, human rights, one might often ask, what are they? They are fundamental moral principles for standard human behavior. It can be through proper health care, it can be through proper communication. This is through the Say It, Let's Talk program, which aims to invest in health and education outcomes of adolescent and young people for sustainable future by addressing their social, health and economic status. The program also targets youth aged 10 to 24, both in out of school, to influence risk reduction behavior, promote behavioral change, and also the most important thing is to empower them. The program also delivers core and layered HIV prevention in management services in settings like TVETs and also in community safe spaces. A mobile health facility, it's also provided for them for HIV and social reproductive health rights services in various community points, improving the most important thing that young people ask for, which is service. Now, welcome to today's episode. I can't wait, guys. I want us to unpack what is human rights. So how have you been? How are you?
I'm well. Thank you very much for asking. My name is Lerato Morulane. I am a beneficiary at Safe Space, and I would like us to embark on this journey that we're about to have and conversate and share ideas on our understanding of human rights.
Lalela, we will do that. That's the aim. The aim is to talk and make sure that we share information with the other young people. But now I want us to, to start with what is human rights and what are they important. But this question I want to give it to Lindo. I know Lindo is an advocate / officer, So I want you, Lindo, to tell us what are human rights and why are they really important, particularly, in the space that we are in.
Hi, Lerato. Again, my name is Thando Kutlengonongono. I'm the Human Rights Advocate Officer responsible for implementing the human rights services within the AYP program as outlined by the Beyond Zero. So the human rights are actually fundamental principles that guides us as humans. It's also, I would say it's a moral way, they guide us on how to behave and to protect other human beings. Our human rights are actually outlined in the Constitution of South Africa. So that is my guideline under the Bill of Rights, Section 2. So I use that as a guideline to help people. So the reason why we came up, or I would say Beyond Zero came up with this program, they've come to realize that most people are not actually aware of their rights, which is why we have human rights campaigns. And most of people have their rights violated. So that's where an advocate officer comes in. If you have a human rights violated or your right is being violated, that's where I come in and assist you in getting justice, because the human rights can be translated or transmuted from human rights to legal rights, and I help people to get justice and to not have their rights violated. I'm also responsible for educating the community at large regarding their rights, and if it happens that they are violated, that's where I come in and assist them in getting the justice that they deserve. Thank you.
Hey, it's so busy. Violation. What is violation? I want you to violation. What is violation? Because for me, somebody might look at me right now. You're looking at me. I would feel like you're violating me. You know, somebody would just pass by. Maybe alata pampiri. That's a not traffic, but it's a certain violation by the law. You know, somebody would do. So what is violation? How would one define violation? Because I come hey, come shoe, you know, you can land in trouble. So what is violation?
I would say that a violation, in simple terms, is something or behavior that goes against certain principles. That's a violation. If I say, please don't touch my phone, for example, and then you go into my phone without my consent, that's a violation of my privacy. So it's something that goes against my principles, or it goes against what I want. So anything that goes against any principle is a violation. An example would be a law, for example. If the police says drinking and driving is against the law and someone drinks and drive, that's a violation because it goes against the outlined laws or principles or guidances. So in simple terms, a violation is something that it's a behavior that goes against principles outlined. So in my context of the human rights, anything that goes against the human rights as outlined in the Constitution of South Africa is a violation.
But it's a violation. Did you hear that, guys? But your phone. Shamina Shawena doesn't work. What's mine? It's yours. So if I tell you don't touch my phone, thou shalt not touch my phone. No. Anyway, so Lahakwe, sorry. You know, I like Karabo, but I also like you. So I want to go to Karabo. So Karabo, I want to know, when as a young woman, what are the, particularly human rights that you see that these are mine? As a young woman, these are mine. He spoke about the Bill of Rights. He spoke about, access to education. So what are the specific rights that are particularly for you as a young woman?
Greetings to everyone. I go by the name of Karabo Mudiba. And thank you for asking. I think the rights for me as a young woman is right to health care, and then right to good education, and then I have a right to my own privacy, and I have a right to be protected to my dignity and well-being, because this right ensures that we as individuals, we are being treated equally and with respect.
See the right to safety. What is do you follow also the responsibility? Because I like the fact that you say you are teaching them the rights and everything. And when you say you have the right to safety, the big question is, are you also responsible in those rights? So if already your right is to be safe, do you lock the door when you sleep at night? When you cross the road, do you look at left and right and left and right again? But we are good that question too. I want you to think more about the rights and also the responsibility behind those rights, because you can have the right, but are you responsible and accountable? So I want to go to you, brother man, and know, what are your rights as a young man, particularly what are your basic, human rights? And are you really responsible for those rights that you're talking about? If you're saying it's the right to be vocal, when you're being vocal, are you insulting people or are you being responsibly vocal and stating proper things?
Thank you for the question, Lerato. I feel as if I am entitled to the right of free education, uh, basic needs met, medical service, and the right of speech. I feel as if freedom of speech is very important to us as individuals, as it is a cry out of your situations that you are facing in your everyday life. So, as I'm doing right now, it's freedom of speech. I'm executing that right of mine that I can lay out my ideas or my problems, you know. So I also feel that I am responsible of my human rights. I'm responsible for applying for higher education. I'm responsible for I am responsible for seeking medical services and
That is fantastic. I love the way you balance them, that you have the right to freedom of speech, but also practice it responsibly. You have the right to education, but at the same time, basic education, but at the same time, you have the responsibility to study and ensure you pass. So, to Tando Kuhle, you know, I mixed Lindo and Tando. Maybe you should be Lindo. I don't know. You look like a Lindo. You,
Yes.
so I can call you Lindo.
Yes, you can.
Fantastic. So Lindo, I want to know, how do these rights help adolescent and young people from discrimination and marginalization? Because you know, young people most of the time we are seen as rebellious. We are seen as too vocal or practicing our freedom. So how do they protect adolescent and young people from discrimination and being marginalized?
Okay. These rights, I would say in terms of helping the AYPs, they actually protect them in order to, for example, to exercise their freedom of speech, as long as it does not incite violence within the society. So these rights, they actually protect them to be able to express them freely as they want. Another right, it's, I would say, to make an example, access to education. We all know that the future of the country is it's based on education. So if people or the AYPs cannot access education based on being stigmatized or discriminated for whatever reasons, that's where we, Human Rights Advocate Officer, comes in to ensure that AYPs or adolescents and young people have access to education and they are protected by these rights. So these rights are important because they protect AYPs in terms of not having their rights violated. So they are sort of like a guideline to protect the AYPs, even though they are not limited to AYPs from 10 to 24. They can go above, but the program focuses mainly on AYPs. So we use them to protect the AYPs.
That's very nice. So I would like to know, in terms of the work that you do, you know, you're speaking about education, but when it comes to health-wise, how are they protecting young people? I want you to go deeper into, you know, explaining or elaborating on how does the importance of human rights and how do they protect, you know, the young people in terms of maybe the discrimination against young people with HIV or living with disability or living with HIV, you know. So how does it protect them?
I would say in most cases that I've seen, when AYPs or young people go to hospitals, for example, probably they would want to get contraceptives, mainly the young women. Most of the time, they are being discriminated by the clinic staff. They would tell them, "You're too young. Are you already sexual active? Why do you want to take these contraceptives?" Which is discriminating. So it ends up like if you don't take the contraceptives, you end up having unwanted pregnancy or teenage pregnancies. And we know that AYPs are actually sexually active. So an initiative must be taken to protect them. So when they go to the hospital, in most cases, they're discriminated and they end up having the fear of going there and getting those services. So my job is to go to the hospitals and sensitize those clinic staff or the nurses in the clinic to make them aware of the human rights violation that they might practice or deny the AYPs the service of getting contraceptives because they are being discriminatory and stigmatizing against the AYPs. So my job is to ensure that the AYPs are not being discriminated against and they get the services so that at the end of the day, we don't have a widespread of teenage pregnancies or HIV. We also try to prevent the spread of HIV. The other thing that happens is the discrimination against the LGBTQ plus community. We also advocate for their rights. They should have equal opportunities or access to medical health services when they go to their hospitals. So I make sure that everyone gets the services that they deserve without being discriminated or stigmatized based either on gender, race, or your sexual identity.
That's great. So, he spoke about a lot, sexual orientation. He spoke about the access to services. He spoke about clinics and nurses. So, most of the time as young people, there are a lot of misconceptions that people hear about us, and when it comes also to the human rights, we know that they'll say, oh, young people have access to services, young people, but there are misconceptions, So what kind of misconceptions or how many misconceptions have you come across as a young person and how did you address them? I don't know who wants to start between you, Karabo and Lehakwe.
Go first. I feel that the misconception that I've encountered is that we are not given the safe environment to speak with adults for us to practice safe sex, because it feels as if we're going to be judged or we're going to be discriminated. So then we end up being quiet about such situations. So I find it difficult to speak to my parents about being intimate, being sexually. So I really find it difficult to talk to my parents about being sexually active and being intimate. So I feel like safe space has made a safe space. So for us to be able to access the freedom of speaking about our problems, facing such things.
You said something very interesting, and I think it would help a lot of our viewers, speaking about intimacy, speaking about your feelings, speaking about, what is it that you want to your parents or to your caregivers. And you spoke about intimacy, or you spoke about having a sexual intercourse, and a safe one, by the way. So meaning using protection, using contraceptives. I want to know, how would you start the conversation? Let's pretend I'm your mother. By the way, ne?
So I must pretend you my mother. Yeah. Okay, fine. People must cast me on this. I should get a casting role.
So, yeah.
So, Mama. Hey. I have issue.
Mama,
mamela. Phela ntwe e concerning and ho hloka ke be safe mos ha ke etsa dintho tsena. A se ntwe mpe.
Ntho tsena na ke eng ya nong? Wa bona a ke na madi, a ke na letho batlang.
Wa di tseba di bed gymnastics? How do you tsebe? O dlala betting.
O batla gore ba di bete tsa ka ya nong?
Ahle mama, ha ke bolele jwalo, mara ntho e ke tshong is how nka ba safe jwang?
Safe nko bue ngwana o batlang.
okay, mama, ke batla ho ba sexually active and ke batla ho ba safe. Ha ke e etsa.
Oh, qadile ka masawana la gago a kere.
Ah, ha se masawana.
Eh,
Sona.
so pila go o batlang. What is it that you want from me, child?
Ke batla o ngute ka the methods of prevention of diseases such as HIV and how to prevent teenage pregnancy.
Wa itse go iralang? Go na le sister Bettina ka tlela. So ke tlo go isa ko ene, mara ke tsamaya le wena, e be re bua. And parents, that's how you do it. So we are going to have this conversation later on about dual protection. So I'm just letting you know that this conversation is going to happen. I just wanted you to get the feeling of it as parents that we are having a safe space, and also we need to ensure that we don't discriminate and we speak to our young people properly. So I want to know from your side, as a young woman, what are the misconceptions that you have come across when it comes to human rights, and how do you address them?
From my side, I've been sexually harassed from school. So it was really bad because I won't forget it. There was the day when I went to the bathroom. When I came back, there was a boy sitting by the corridor. And then he came across me, and then he touched me the way that I didn't like it. And he also insulted me the same time. And then I went to report him. That's when the case started to be talked about. And then we talked about, and then it involved the police, and then my parents, and then it was not a nice thing because going through all those things and letting mo sekolong, so whenever school was about shebela classy, because when o hlahetswe ke such a thing. So I feel like the boy didn't matter how I feel, and then he just took my rights for granted. Yeah, and then he told himself, oh, I'm doing this because I want to. So at the same time, I felt so pity for him because I nearly arrested him. So it is not nice to be done like that. And then I would say, like, I just feel like it is important to talk to our parents about having sex and then all those stuffs, because they have went through all those things. And then maybe ba tlo refa the advice tse betere tse leng hore different tsa rona a bana refa tsona. Tse more important because bona ba tseba from back then, ba tseba for now ho etsalang.
That is very touching and also very bold and brave of you to share, your experiences, and Pepi Nage for that. We don't wish that to anybody. And as an advice to everybody out there, is that whatever that you do, my rule is always to say, if I'm laughing and the other person is not laughing, then it means that they are not feeling comfortable about that. We laugh with each other and not at each other. And we need to ensure that all the time, that whatever that you do, you ensure another person is comfortable and safe. So I want to know, starting from you, Malindos, Tandos, that how do human rights relate to accessing health services for adolescent and young people?
Okay. If you check the Constitution of South Africa, that's my guideline though, so I'm gonna keep on referring to it. Yes. It has on the Bill of Rights, right? Section 2. Everyone has a right to access healthcare. It's their fundamental. It's a basic fundamental right, and everyone should have access to healthcare without being discriminated, or I should say, there should not be a barrier to accessing that service. So that's where the human rights comes in. It's their fundamental human right to access basic health care, free here in South Africa. So when adolescents and young people want to access that service, they should be able to access that service without any barriers to accessing that service. So that's where I come in. Should there be a barrier of any sort, even if it includes, it cannot be like they can, maybe sometimes they deny them service. Sometimes it's a poor service. Either way, if it's a poor service, that's where I come in. They call me. If they denied access to service, that's where I come in.
So I like the fact that you spoke about, being denied access to service. There are different concerns. So how would I know, Horing, I'm a 12-year-old or I'm an 11-year-old and I want to go to the clinic and access a certain service? How will I know that I'm being denied? And I'm a 16, or maybe I'm a 16-year-old, I wanted to access service. I want to use these two scenarios. 11-year-old wants to go to the clinic and access maybe depot or condoms or maybe just information about health. And then we have a 16-year-old. So how would they know that they're being denied a service?
Okay, in terms of probably say they want to go get some contraceptives, by just being turned away from getting that service, probably they tell you that you're underage, or there's, I feel like us as Africans, we are so culturally intact that an adult, is no, usantane ule munyane for that, and then they turn you away. That's how you would know that you're being denied access to a service, by being turned away or by being totally ignored by the staff of that particular organization that provides such services. So by being totally ignored, even though they know, or you've stated when you went in, what did you come for? So if you're being turned away, that's how you know that you're being denied service. If you're being totally ignored, that's how you know that you're being denied services. In both instances, the age of 11 years or 10 years and the person who is 16 years old. That's how you know.
Fantastic. So I want to know, as young people, we are definitely aware when it comes to seeking healthcare services. Have you encountered, a predicament whereby you were denied access to maybe getting information, maybe getting, contraceptives, maybe just going into the clinic, Jay? Have you had that experience?
Not really. Not really.
From my side, I did. But then when I arrived at the clinic, the nurses were there to judge me. Why do you get this? Are you now sexually involved in sex at your age and what's so old? And then now while my mother was protecting me from having a child, yeah. So when I give it more like they are there to judge.
Listen, you are still young, you can't be doing this, you don't need to do that. Okay, so when you've had good experiences, please share them with us. Or you've never been denied, and I believe that, which means you've been part and parcel, and you spoke that you have been a beneficiary of, safe spaces. So how has your experience been?
I'd say my experience has been wonderful. It has been wonderful. For example, the other day, I had come here to Safe Space so that I can know my HIV status. And I could say it went effortlessly smooth. There was no troublesome, there was no hesitation. I got tested immediately. And I could say that I'm proud that I know my HIV status. I feel like every young person, or each and every individual, is supposed to know their health status. And again, another service that I received here at Safe Space as a beneficiary is that I finished my matric last year, so I didn't apply. So I came here to Safe Space so that they can help me. And then I got Rahuapti Godfrey, who's an ESL. And he helped me apply to institutions, and funding schemes and, bursaries. So I'd say those are the services that I've received without any troublesome. One that is unrelated to safe spaces by the clinic. When I went with my partner for advice on how we can prevent teenage pregnancy, what methods we can use to prevent it. So, and we were given those methods. So that's one of the things that I would say that I haven't been denied any services.
You've been given, your full basic human rights. And speaking about that, I want also to touch on, as young people when we access service. So the ages of consent, 12, it's the age of consent to healthcare services. 16, it's the age of consent to sexual because I hear you speaking with your partner, about having sexual judge. Listen, this right now I'm not wearing the mother hat, hey. So judge. So the age of consent to sexual debut, it's 16. However, with the 16, it doesn't mean that you have to have sex with a 30-year-old. No, there's the Romeo and Juliet clause, whereby a 16-year-old is allowed to have sex with somebody who's with, is it 2 to 3 years age bracket. So thou shalt not, as a 16-year-old, go and engage with a 30-year-old. It's going to consider it as what? Statutory rape. You understand? So that would be somebody infringing on your basic human rights. We also have the age of consent to marriage, which is 18. So if you're 18, mara ke re lo nyala, he, ha ke re o nyala, because ke a go utlwa gore wena, hey, ula, uvaka. So I want to go back to you, Karabo, and if you have had a positive impact when it comes to human rights, accessing your basic human rights in healthcare services. Have you had a positive impact, and can you share it with us?
No, I haven't.
Guys, see me. Safe space. We need to come to Karabo and show her the things that, listen, we are here because you can get access to all the healthcare services that you want, and, without any judgment. Don't go, utlile brother man, got tested for HIV, got his result. He tested, I don't know if for high blood and other things he did, because, most of the time we speak only about HIV and accessing services, basic services. It's everything. It's your reproductive health, but also health-wise. So test the TB and all those kind of stuff. So before we close, I want to know what resources are available for adolescent and young people to learn more about their rights, to seek legal support, and how can they access them? Detailed. Or if you have a phone number,
Okay. The resources that we have IEC material. The IEC material, it's the pamphlets that we distribute throughout the community that educate the AYPs regarding their rights. We also have safe spaces. In the safe spaces, we usually have dialogues with the AYP, so they can come through to our safe spaces if they need information regarding their human rights. So in these dialogues, we address a lot of things, but specifically, I would say it's know your rights campaigns and dialogues. So we also have, if you have a case that requires legal services, maybe it has gone to an extent whereby you need to go to court, which is, I would say, it's part of the resource that we provide. We work with paralegals that we refer our AYPs to in order to access the legal services free of charge. So those are the resources that we have. We have peer education, we have other stakeholders around the community or the Dihlabeng and Sesotho that we work with hand to hand in order to deliver the best services to our AYPs. So it's IC material. We also have our influencers and our field workers that go into the field and educate people regarding the HRV human rights violations and how their rights are more likely to be violated. So those are these resources that we use in order to reach the AYPs. Sometimes we also do community outreach campaigns. We do campaigns, marches. So yeah, we're all over the community. We try by all means to reach people and educate them and let them know that they can access legal services and they can get education regarding their rights should they be violated. So our safe spaces are open if they will want to get any information regarding the human rights, and if they have their rights violated, they can come to the safe space and report any human rights violation that happened, and then we will attend to that. We also have, we use social media. We have our own pages whereby we will get all the details that we need, including the number phones. So they can use any of those platforms in order to access the services of human rights. But it is through CCI that you can get any services that you want regarding the human rights.
Fantastic. Thank you very much about that. So I want from you guys, Karabo and Lag, to, if you had, think big, ne? If you had a blank canvas, a blank page, for a to-do list for young people to have full access to human rights, whether it's education, whether it's health, whether it's agricultural wise, what is it that you would prioritize? You want to go first? Okay. What is it that you would prioritize? Okay, I can go for million. Prioritize human rights for young people. What is it that you would prioritize?
I would prioritize the awareness campaigns. Okay. I feel like they are very important and they gonna who reach a bigger target audience. Mm-hmm. So, for example, at the mall, people go to the mall constantly. So, and people would be able to see those posters and banners around the mall about human rights, and and as in the community as well. I feel like it's also important because children or young people, they get afraid to step up. So I feel that an awareness campaign is the right or the suitable thing to do so that young people can attempt to know their human rights.
Awareness, so that people will know what are human rights, how, where to report, how to report if they were to be violated. And you? What would you prioritize?
I will communicate the young ones with people who will be able to talk to them, and then baba bear handle, and then baske baba judge, because one of the most things it's angry bacha bathabe who communicate, it's because they're being judged by other people. So I will communicate. I will like them to communicate and then to talk if there is something bad happening to them.
So you prioritize maybe the support group, for young people that feel like, you know what, my rights have been violated. I can't speak to my mom because my mom obotsa sister Bettina, sister Bettina abotsa mamang, and then mamang abotsa mamang, and at the end of the day, whatever that I went through, it becomes the talk of the town and exposed. I like that. So, ke le fa 30 seconds ne. What is it our viewers right now about human rights, about the protection of human rights? I'm going to start with you, brother T-Man.
There's something that we realized within the human rights violation program, right? It's that there are policies that discriminate against people. I'll make an example. There is a school policy that discriminates. I'm not gonna say it discriminate, but somehow it violates the rights of the children to access education. So most of the school policies, they will tell you that if a learner is above the age of 14, they cannot do grade 8 because they will bully their peers and everything. So that actually violates the right to education. Probably you had challenges in life, you couldn't get to school at a certain age, but most of the time they're being chased away. So what I would tell the viewers is that if you know of any policies that discriminate, whether in private or public sectors, please report them to the Human Rights Advocacy Officer, because one of our job is to review discriminatory policies and challenging them in all levels, from the provincial, judicial, and legislative, and try to change those policies that discriminate against people. So I would say that the viewers, if they identified any policies that discriminate against anyone, whether it's people living with HIV and AIDS, people living with TB, the LGBTQ plus community, and the general public. If you have seen policies that you feel like they are being discriminatory against the general public, please come and report them to the Center for Community Impact and the Human Rights Commission, so that we can challenge these policies and they can accommodate anyone. Thank you.
Thank you very much.
So I like to ask the young people that are sitting at home, and I am also a young person, is that, guys, do not stay quiet. I know that batswadi ba discriminate kapa ba o judge ka tsela tse sa jumping, but then raise your concerns, raise your voice. If o hloka thuso about your medical status or your medical health wise, inform support groups, go to such spaces as Safe Space, inquire them about your situation at home. So Nantukil Kopanyona, guys, is that skatulang. It's important to raise your voice and make sure that it's heard. That it shouldn't be silent. You must just say it.
Monna Mosotho a bula re ngwana a sa bueng o shwela tharing.
What brother said. So, batjha re bolawa ke hore most of the time ha re bue ntho tse re di jang. So re end up re decide to communicate the suicide. Kana go re na le batho be re nka buang le bona pela rona. So if ever something ya oja inthe, so that o kgone ho fumana thuso, because it's not nice end up being an sedentist or taking your fellow colleagues down. So
thank you very much, guys. But buang, talk, kuluma, teta, prat, bua. I'm going to say it in different languages, but the most important thing is that whatever that you go through, talk, go out, seek support. Thank you very much, guys, for joining our episode today. The Say It, Let's Talk, Unpacking Human Rights episode is brought to you by the Beyond Zero team. The Say It, Let's Talk program is also making significant strides in empowering young people and providing them with tools that lead to healthier, more fulfilling lives. And if you need more information about safe spaces and guidance, please, on sexual reproductive health and rights, please call us on 012-880-3160. Or you can send us a message on our social media pages at Beyond Zero SA on Facebook, Twitter, and Instagram. And also at Say It, Let's Talk on Facebook, Twitter, and Instagram. Say It, Let's Talk for empowered youth and adolescents.
This podcast is brought to you by Beyond Zero for its adolescent and young people's program, Men Who Have Sex with Men program, and Transgender program. We are Beyond Zero.